I've heard a variety of different options. Again, I think it all goes from doing an analytical model to determine what the impact is before you make any rash decisions. A lot of this stuff has been thought through to get around companies breaking up or having everybody work part-time, and I think sometimes it's a quick response rather than a thoughtful one. A thoughtful response would be, what's the impact of having only part-time employees? Will my employees have enough income to live? What does that say to the community as far as my taking care of my employees and their welfare? It's difficult for employees now, and I just speak from my own personal experience. It's rather difficult to forecast what you're going to experience this year as far as health insurance goes and health care. And it's hard enough when you have all the support of your employer. Just imagine all your employees doing that on their own at an exchange. I think it's going to be very difficult, and I think it creates a lot of risk for the employer as far as not only for the health insurance side, but absenteeism because they're at medical doctors and all that kind of good stuff. So the most creative way that I've heard of is, with healthcare reform, if you have more than 50 employees, you're to offer benefits that are affordable and adequate. That doesn't necessarily mean if you do that all your employees are going to come on the plan. So that's kind of a fear that's out there by some employers. And then there's some other vehicles that people are using to mitigate some of the risks of people going out to the exchange. So I've heard of some creative solutions in those areas. I will quote Kelly Davis from our office, and that is the ostrich effect. And that is that if they stick their head in the sand long enough, this is all going to blow away. And I think some don't realize that it is law now, and there's going to be a lot of regulations coming out, a lot of things that employers have to do to make sure they're compliant more than ever before. And we believe, people in our industry believe that it's here to stay, and so it's important to be proactive, understand what's going on. And one thing that we do that's been a real benefit for our clients is we create a toolkit and it's all about implementing healthcare reform, which in the business, whether you're a small employer or a large employer, those are some of the things that we see are extremely helpful.